Because it's like back chat. THACK chat, yeah? For God's sake. Hiya, and welcome THACK to Welcome back to THACK chat. And today, a quite sobering video, but I think it was quite important to A, set the story straight, and B, doff my proverbial cap to an incredible website called venturecapitalist.com. Don't let it put you off. It's not all about the push and shove of banking and how much money should I be throwing at Elon Musk. There's a lot more to it. Data visualization, it's the big thing these days, all about the curves and all that stuff, but it goes into a lot more detail in this particular article about the three angles, if you like, on which we're waging the war against coronavirus. Now, like I said, quite a sober subject, but I think it's really worth mentioning at this point. Essentially, those three angles are diagnostics, treatment, and vaccines. And you'll hear Bojo going on, although obviously he's got the virus, but you know, we can still talk about it, probably with some authority these days. Talks about how diagnostics are so very important, and straight away something you need to know is that testing is happening apace everywhere, and there's so much going on at the moment in terms of the different kind of varieties, if you like, of treatments. And now diagnostics, now there are 41 various different diagnostic kits, if you will, that are being developed at the moment all the way across the world. Great work. The challenge, of course, is shipping, the distribution at velocity. That's the real big challenge here, is getting them from the corners of the world that have already had a little bit of practice at this, and obviously while they need it, making sure that we get it too. So really, really important that that carries on. In terms of treatments, this is a really interesting one. It's something that perhaps we don't shine a torch at as often as we should, but effectively there are three parts of that jigsaw too. One is treating the symptoms of the disease. The second one is the, if you like, figuring out how to reduce the inflammation. So a lot of respiratory inflammation, a lot of this illness is down to that. So that's a treatment as well. And the third one, of course, is how do we stop the spread of the pathogen once it enters into the body? What happens there? And there's an enormous amount of stuff going on right now. Now, there's some really good existing cures, I don't suppose you'd call it that, but certainly treatments that are actually helping to arrest the spread through the body, and obviously ultimately to actually build healthier people once again, to get them back into the system so that people are resistant, and then develop that immunity, if you will, if that actually bears out. Because we don't know right now, do we, in terms of the disease is so young that we don't know truly whether people will have that immunity going forward for a long time or for a shorter period of time, and whether actually the weather will have a big determining factor in that. Will we start seeing that as the weather gets warmer, so the pathogen starts declining its fierceness and its magnitude? So really interesting stuff there. Now, talking about treatments that are already out there, you may well have heard about the anti-malarials, so remdesivir, hydrochloroquine, and there's also an interesting one called Avigan, which was built by the healthcare subsidiary of Fujifilm, but ages ago. It's an elderly drug, and what this does is it effectively helps people to recover from flu. And obviously, as you know, because coronavirus is effectively a flu and this is the COVID-19 strain, then obviously that bears similarities. So there's going to be components of this pathogen that actually will be affected by drugs that have been developed for other strains of the coronavirus. And again, I'm not talking about this from a medical standpoint. I'm really talking about this to encourage you to go and visit venturecapitalist.com, because it breaks down in this particular article all of the different diagnostics that are being built, all the different treatments that are being built, and specifically now the vaccines. Now, what's interesting about vaccines is we've already got 5 vaccines that are in clinical trials right now. One of them, which is called the mRNA 1273, is actually in human trials in Washington State right now, and actually beat to the punch animal trials, such as the magnitude, severity, importance of finding vaccines, though ultimately, you know, figuring out how we're actually going to get these people to not even have to suffer COVID-19. This is why we're working at such pace, and this is why right now there are these vaccines that are going about that are really making a difference and showing early signs of opportunity. What's interesting about this mRNA 1273 is that being very bullish about the situation, They're actually suggesting that this may be available for healthcare workers as early as this autumn. Now, that's not something that you hear every day, and this is why everybody who's involved with this particular vaccine is really, really excited to see how this plays out in these early clinical trials on humans. Now, this is the earlier vaccine, if you will. There are a lot of other vaccines. There's a vaccine, because what a vaccine does is effectively a teacher. So what the vaccine will do is it will enter your body and it will tell your immune system how to fight off these nefarious pathogens. Now, as I say, there are two. There's one which is the sort of almost like a teaspoon, if you like, a dose of the pathogen itself. And there is also these subunit vaccines, which could be like a surface protein of the pathogen, a fragment of the pathogen. So therefore, that's even less. It's still invasive, but it's even less of a big thing, if you like, than the vaccine that's being tested at the moment in Washington State. And there's in the region of 41 of these in development at the moment, in the preclinical state, that would actually be, that's a next year, that's a 12 to 18 month thing. But what's really exciting about this, and as I say, you can tell straight away that I don't talk from the perspective of a physician or a clinician. I've not got that experience, but what's exciting is you'll see so much doom and gloom out there in social media about the fact that we don't know what to do, we're powerless, but we've already talked about things like immunity. Is that, do we know that if somebody's had it and they may have had the mild symptoms, so they might not have to have endured all of the respiratory inflammation that causes all of the critical illness stage of this virus, have these people actually got the opportunity then to go back to work? Have they got a chance to go and help the NHS to fight against COVID-19? Things that we don't tend to talk about, because a lot of it is doom and gloom, and it is a gloomy situation. This is an epidemic, it is a pandemic, but there are some small shoots of opportunity and signs, glimmers that actually what's ahead of us could actually be better than what we fear, though obviously right now everything is in flux. So I wanted to tell you this because I think venturecapitalist.com is worth visiting. You'll find out so much more, and it actually puts it in plain English, which is something that I've obviously struggled with here. Definitely go over to there. I'll include a link wherever I publish this video. Definitely worth going and checking out. But also, there's a great newsletter, which is where I found a link to this Venture Capitalist article called Briefing Day. That's at briefingday.com. Don't know if anything like me, but you like to devour information. And there's some really, really good newsletters out there. TL:DR is another one that's definitely worth looking out for. But briefingday.com, as you might expect, comes out every day, packed with relevant, insightful news. And at the moment, obviously, because every news outlet is obsessed with COVID-19, then obviously that's got its fair share of news about this too. But check it out, briefingday.com, venturecapitalist.com. Stay safe, stay healthy, stay inside, don't be a bojo, and I'll see you around the corner at the next THACK chat. Bye for now.